Welcome back to the Pontio Podcast. In today's episode, we have Rob with us, who is a rotational Band 5 physio. Welcome, Rob.
Thank you very much. Thanks for having me today. I'm excited.
Yeah, excited too. So first of all, could you tell us a little bit about your transition from a student to the position you're in now?
Yeah, so I was relatively lucky. For mine, I started off on general medicine. So when I came into the trust, had my induction, and then I was kind of eased in. I had quite an experienced band four with me, so it was really helpful. I think what catches you off guard going from student to physio is having that autonomy. And the big one for me was like discharge and referral pathways. You know, when you're a student, you shadow, you learn, you do your assessment, treatments, etc. But then, stuff like discharge and planning for home and where they're going next, you don't do as much of. So I think that was a real shock.
So we'd say, so the referral pathways, understanding when the patient's right for a certain pathway, that's the biggest shock you found.
Yeah, exactly that. So,
Okay.
If they meet eligibility criteria for example, onward rehab, if it's any community team or a community hospital, or for example, if you're on stroke, if they need to go to a specific level 1 or level 2 neuro rehab facility, and the criteria for that, it might be just they're going home, and it's just checking, do you have the equipment needed to be safe at home? Other options like community rehab where they need to be at a certain mobility level, or have specific equipment in place already. Yeah, bits like that. But that's what got me first.
Interesting. So when did you start to feel a bit more comfortable with the referral pathway process?
It took me a few months.
Okay.
We had quite a good discharge coordinator as well there, and she was there on hand to give a hand. If I was a bit unsure, I'd either go to her, or kind of chat to the other more experienced members of the team, just to get a grip on it. But it took a couple months at least.
Would you say that was your biggest challenge, or was that something else, moving into that first position?
I would say going into on call for me was one of the more nerve-wracking bits of it. Obviously, when you're there during the day, you've got doctors, you've got nurses, you've got the full staff in, so you've got other people to ask. I think the hardest kind of bit was on call, because that's where you're fully autonomous. It's just you. Obviously, if you need a second pair of ears or just someone to run things over, we did have our band 7, so we could give them a call during the night and just check in. But yeah, that was the hardest.
Yeah. So when you so obviously graduating from a student, we learn all our skills in terms of clinical reasoning, but we're told once you start working as a newly band 5 physio, that's when the real learning starts there. What helps you develop those critical skills like clinical reasoning, for example?
Experience. For me, the more patients you see, the more comfortable you become, asking where needed. As you said, the real learning does take place for when you graduate, and that was the case for me as a student. You can ask questions, make silly mistakes, and it's fine. It's part of the learning. That's the reason why you've got an educator, and why you've got a team around you to help you. That does still transition into when you qualify and when you get a job. There are still people around you, but you are going to be more autonomous in learning.
Okay, and how has your confidence changed as your autonomy has increased?
As in, kind of, as what do you mean? As in,
just your general confidence in terms of treating patients, your general demeanor when you go into work.
much more comfortable. So right now I'm in outpatients, and again, it's almost like starting the process over. For inpatients now, knowing what to look for, and what you're checking, if it's kind of a respiratory patient you're looking at, and you're checking OBS and what their SATs are and what scale of oxygen they're meant to be on, stuff like that. Whether it might be a stroke assessment and you're looking at any deficits, you're looking at their coordination, balance, strength, whatever it may be. But it's definitely improved with more patient exposure.
And as the feedback from your supervisors and your superiors, has that helped you to find what areas that need more focus than others?
Yeah, massively. So, like you would have an educator when you're a student, you then have a supervisor when you move into practice. So it'll be either a band 6 or band 7, someone who's been there a little bit of time, and they'll sit you down, have a chat with you, and go through any learning needs, any areas where you're struggling a little bit, what's going well, because it's important to reflect on what's going well as well. It's not all doom and gloom when you get in there. It is enjoyable. So it's really nice to have that continued support from student and transitioning into band 5 rotations.
And how would you balance the learning to the caseload? Do you find that challenging, and how do you deal with that?
Yeah, it's a continuous learning experience. So you do have to put in some hours outside just to, if you need to catch up on a certain topic. If you're rotating, so MSK where I'm in now, I didn't know much about MSK assessment or specialist conditions or, treatment options. So that was a complete new set of learning where I had to do a bit outside. What was the other bit? Sorry.
Just generally, how would you balance it between the
Balancing
caseload
battles, yeah,
itself? Yeah.
sorry. Yeah, in terms of balancing, just kind of I can't compartmentalized. So I'd treat priorities and go, okay, I need to see XYZ first. Then if there was anyone I needed to move into kind of afternoon or see someone later, then I'd do that, but just making sure I had enough time. And if I didn't, then letting the staff know and the rest of the team know early on. So if cover was needed elsewhere, I wasn't running against the clock, come 3, 4 p.m. trying to make ends meet. So communicating with my team was probably the best way to handle it.
Would you have a strategy for yourself in terms of the areas you want to go and research further? Would you have a strategy to identify those areas, or is it kind of you just go home and you would know internally what you wanted to have a look at?
So a lot of it came when I was learning, because you don't know what you need to know until it comes to you. So if it's a specific condition you need to read up on, if it's neurological, if you need to find out what FND or MND or kind of how a stroke might present, or respiratory, differentiating something like asthma or COPD to something like cystic fibrosis, just whatever patient kind of you interact with or see, that usually informs what I need to look into, because then I understand my gaps.
Bro, and it'd be interesting to know what method you use to go and research those areas. Like, how would you go about it? So I'll picture the scene. You've just come home from a day of work, and you've got your laptop out, for example. Where would you go next? How would you start to dive deeper into that topic?
So if I do it for where I'm at now, so in MSK, I'll see a patient and, they might have some symptoms, but I'm going, okay, what could that be in relation to? Or I could be thinking, okay, I can't really identify like a clear cause. Then I'd read around kind of the condition or read around the symptoms to try and help my clinical reasoning. So, identifying they might have weakness, when I'm testing hip abduction, for example. I go, okay, we need to work on that. Or it might be, I'll go into RESP, for example, when I was an inpatient, and I go, okay, that's XYZ, and I need to do XYZ treatment. It would then be, I've completely forgot my train of thought with that one.
That's absolutely fine. Don't worry
Sorry,
about it.
I had a very clear point when I moved from MSK, and I couldn't remember where I was going with it. It was something to do with RESP, about how I would go about it when I got home. That's stumbling.
Don't worry. I'll move on to the next question. So we can edit that out.
No
It's absolutely fine. Well, let's see. Any questions about that? That I want to ask more. Cool, perfect. So what has been your biggest clinical learning moment you've had so far?
Clinical learning moment. Ooh. I would say being in a family meeting for the first time was a clinical experience that really resonated with me. Seeing firsthand, the impact of not just a stroke on the individual, but also the ones around them, their family. And it was in regard to kind of discharge planning with them. And home wasn't an option. And talking around that, it's a very sensitive topic because their life is changing. And I was in a meeting with kind of occupational therapy and nurses and discharge coordinator, the whole kind of team. And I think that was a clinical experience that really kind of resonated with me, because it was controlling your emotion, being objective, speaking clearly and making a clear plan with the patient and the family about what the next steps are.
Yeah. How did you prepare for that moment, or did you prepare for that moment?
Not massively. We knew there was going to be a meeting at some time, but scheduling is quite difficult when you're in an acute hospital. Obviously, you know, nurses or kind of doctors, people get called away if there's an emergency or anything happens. So pinpointing a time, we knew kind of roughly, and it wasn't until kind of evening before where everyone went, okay, we spoke to the family, it's going to be tomorrow morning. I was going, okay, all right, fine. And I'd only really had a month and a half, maybe 2 months in neuro at that point. So the criteria to me was a little bit, I'm not too sure, but again, luckily discharge coordinator was there. So it was just focusing specifically on the physio aspects, you know, what were their strengths like? How have they been in terms of rehabilitation? How long have we given them? What are the positives that we've had? What are the challenges we still face? And just targeting the physio side rather than going, okay, I need to worry about all of this. So for me, it was just compartmentalize, focus on the physio aspect. You've got your other colleagues to come in from their side. You don't need to go into loads of detail on behalf of them.
Yeah, bro. So looking back at that moment in terms of that family meeting, is there anything you would have done differently? And what skills would you say a physio needs during that setting, during that moment?
Yeah. I don't think there's too much that can prepare you sometimes. Again, like I spoke about experience earlier, having patient experience and talking to patients, you know, not just going in, okay, we're doing X, Y, Z, have a little chat with them, you know, 5-10 minutes of building that rapport can go the world for some people. So to answer a question, I don't know what could really prepare you. It's just experience with it. The more people you see, the more times you have meetings like that, and not shying away from it. I think as a student, you know, you could be quite protected, but if you keep hiding away from, you know, difficult aspects or aspects that you don't particularly like, you will eventually have to deal with it and you'll feel even more unprepared for it. So getting exposed to it early on and making sure that you stay in touch with those areas, so that it won't catch you off guard and you can perform as you need to.
Oh. And is that kind of your advice in terms of dealing with like challenging days as a physio in general? Just more about just throwing yourself into these into different settings and different experiences, and then reflecting on it afterwards and seeing what you could do differently.
Yeah, 100%. Obviously, if you are new to it, letting someone know that is there that's a bit more experienced, you know, hi, this is my first time doing this. What can I expect or what can I prepare? Just to give you a little bit of a head start so you're not completely caught off guard, because there will be questions for you and sometimes you won't know the answer. So it's important to at least have some sort of preparation. You know, they might ask, what's rehabilitation going to look like? Or in terms of next steps, you know, what are the options that I could be going to and what can I expect from the therapist that works there? Things like that. So using your more experienced staff members to help you through those challenging times is really important.
Yeah, and probably more importantly, how do you enjoy the job?
I wouldn't do anything else. I really wouldn't. You know, it's not easy, but that's what makes it so interesting and makes you want to get involved as much as you can. It's a job that it doesn't end. There's always something new to learn. There's always a different area to research in, and the job possibilities are kind of endless in terms of where you want to go into. Even if it's out of hospital and you want to do something like neuro, you want to do something like falls assessment, you want to do something in kind of community hospitals. It's just so much variety to it, and that's something I'm really enjoying.
And is there anything you do in your day that to help you with that enjoyment and make sure you feel and you continue that feeling of enjoyment rather than focusing on these challenging scenarios that you're not quite comfortable with and you need that further experience? Is there anything that you come back to and go and remind yourself, this is why I enjoy it?
Celebrating the little wins, massive, you know. So right now I'll have appointment slots for MSK for outpatients. Sometimes I might have like an admin slot just to catch up, but you know, just a quick, all right, how have my previous patients been? How are they going? On the most part, it's positive. Unfortunately, we do usually focus on the negatives because, you know, you're expecting positive, you're expecting perfection, and sometimes life isn't going to pan out that way. So celebrating those little wins are so crucial.
And how do you do that? Is that through written, like a reflection, like a weekly, daily reflection? Is that something you normally do? Yeah.
I'll usually have a chat with one of either my supervisor or kind of one of the other members of the team. You know, they have like a doors always open policy, and it really is, to be fair. They're really supportive. So you know, if they've not got a patient in, the door's open. You can have a chat and just go, look, I've just had this and it went really well. yeah, we're having a good day today, and they'll be like, yeah, I had this, and you're just bouncing off each other positivity, and that's so important, especially when a lot of the time in hospital it can be negative experiences for a lot of people. So I'd say kind of verbally and bouncing off someone else, and just internally I'll reflect and kind of go, okay, I need to do X, Y, Z, and then I'll come back to my CPD and go, okay, I need to revise this. I need to look at anatomical locations for this, and then I'll just tailor my learning that way. But yeah, I'll express it with other staff.
Is that something you've always done since graduating and working as a band 5, or is that something you've had to learn as well?
I did a lot of written reflections for myself, anyway, going from student, especially at the first part of my band 5 experience. We had a year-long course of preceptorship, where it's almost helping you transition from student to graduated band 5. So, you'll be expected to do some reflections, some learning. They'll have little courses for you to go through. For physio, there was, for example, respiratory physio specifically. So you'd go through, what does an A to E assessment look like? What are kind of the methods of treatment that you might use for a respiratory patient? So they gave you kind of some courses to focus on and go through to help with that transition.
Bro. And so you mentioned earlier about the wide variety of physio and all the opportunities it can provide.
Yeah.
Looking ahead for yourself, where would you like your career to take you?
So I'm at the end of my rotation. I'm moving out to Australia with my girlfriend, which will be amazing. And then I'm going to look for a kind of physio job there temporarily. And I've got a working break, which is so thankful for, which means I can take almost kind of year and a half up to 2 years and then return and carry on, how I left off, which I think is so important, having that job security and then also something to look forward to. I don't know what to expect from Australia and what the physiotherapy is like over there, but I'm going to look there, hopefully in outpatients. I'm not going to limit it. I've enjoyed inpatients, but yeah, I'm excited to see where that takes me.
That sounds really, really exciting. So I wish
awesome.
wish you success with that one.
Oh, thank you.
And so if you could relive your first year, working as a band 5, was there anything you would have done differently?
I don't think so.
Good.
It took me a long time to kind of get in the swing of things, but I really enjoyed it, and I'm glad I stuck in there. I think if I went back, I'd tell myself, because I was on medical, it was about seven months, something like that, and it did drag towards the end. It was great for the first few months to get in the life of a hospital and learn discharge pathways and what team handles what and what everyone does and how they interact. But then after 5-6 months, it's okay. We're starting to get a bit repetitive. I was feeling more kind of like a cog in the wheel. And our medical, obviously, shock. It's medicine takes precedent. We were there for mobility assessments, discharge planning, and it wasn't really for me. So there was a time where I was going, is physio really for me? What have I got myself in for? But then I had neuro rehab, and it made all the difference for me. Seeing what rehab can do, taking them down to a gym and seeing what difference can I make, and using clinical reasoning to go, look, we've got a deficit here, let's have a little look at a few different exercises to work on that. And yeah, that really changed it for me, going to neuro rehab. So for my first year, I don't think I'd change anything more besides telling myself, look, stick with it, it's going to get really good, you're going to enjoy it. And yeah.
Would you say that those experiences that you've not felt like it's ticked your box, for example, do you think that you still carry skills that you learned in those settings forward with you into settings you do enjoy more, or would you say they're completely different and they're not related?
Massively. So depending on what area your trust is in, the discharge pathways or community teams will operate differently depending on where you are. However, from inpatient to outpatient, it's still going to be the same teams that cover that area. So, for example, medical, if we're referring someone to community rehab or a kind of a help group, it could be like Alcoholics Anonymous, for example. It could be a drug help group. It could just be an exercise class, just a group activity that they can turn up to. Knowing what's around in the community has helped both inpatient and outpatient, because if they're still struggling, going, look, I want to engage in exercise, I can't keep coming to the classes here, is there anywhere in the community that you know of? Yeah, fantastic, because I've done referrals before and I've signposted people before. Yeah, and I've taken those skills definitely from inpatient to outpatient.
That's perfect. That's great to hear. So we're going to end the podcast with a quick fire question round. So first question is going to be one word to describe your first year as a Band 5.
Amazing.
What's the biggest lesson you've learned since qualifying?
Get as much exposure as you can.
One thing you wish you'd known before your first day?
It's going to be fine.
One habit that's made you a better physio?
Clinical reasoning.
What's the best piece of advice a senior physio has ever given you?
Must, shoulds, and coulds regarding what you can do for a patient.
So complete the sentence. If you're a newly qualified physio, remember...
Listen to your patient.
And if you could leave every newly qualified physio with one piece of advice on a post-it note, what would it say?
Take care of yourself first.
Real. I really like that. Well, thank you, Rob, for joining the podcast today. Really appreciate you sharing your insights and your knowledge.
No worries at all. Thanks so much for having me.
No worries. Thank you so much, Rob.
Take care. Bye.